that gets it done.
Totally fair.
Yeah, keeps it steady.
Good to see you.
Yep.
I often wanted to try to use a monopod when I was working,
Good morning. My name is Sharon Mortensen, and I'm a member of the Midland County Health and Human Services Council. And it's my pleasure to welcome you here today to our community update, our community health improvement plan update as well. And I'm pleased to do this along with, really on behalf of all of Health and Human Services Council and our presenters today. So the Health and Human Services Council, you're going to hear a little bit more in just a moment, but we're a collaborative group that work on just what our name says, health and human service issues here in our community. And as part of that, I serve as chair of the Health Committee, which specifically works on our community health improvement plan. In addition, I serve as president CEO at Midland Area Issues. And you can find out more about some of that community work at maxlovesmidland.com. But we're here to talk about Health and Human Services Council today. And the work that this group does is we promote the welfare of the community through systems level planning, collaboration, and promotion of health and human services with an emphasis on demonstrated effectiveness and prevention. In other words, we come together and we work with all that we have from across a variety of sectors to make sure that we are doing the best for our community in the areas of health and human services. And we have some guiding principles that help to direct us, and we understand that people have complex needs that cut across agency boundaries, which is why we come together in collaboration to work with one another. We know that collaborative services produce the best results and that local people solve local problems, and that's what we come together to do. Now, a little bit of background on the Health and Human Services Council. It was established in 1998, so a few years ago, as a common community interface with state agencies on state collaborative efforts in human services. There's a strong interest in poverty and housing issues, health trends, family relational, and youth issues. Also, Health and Human Services Council serves as a state-endorsed multi-purpose planning body. And United Way of Midland County serves as a Health and Human Services planning staff, and they are our backbone organization that provides support to this group. And it was formed, as I mentioned earlier, to foster collaboration and cooperation among agencies, education, healthcare, business, the faith community, courts, law enforcement, city and county government, all of whom are represented as members on the Health and Human Services Council. In 2024, we had some things that we were working on as well as a council on restructuring our council meetings, engaging in greater advocacy, making sure that we're capturing the voices of all across our community, increase public awareness and presentations, marketing, looking at summits for the future, discussion about issues, using data to help drive our decisions, endorsing reports, and you'll hear some more about that data that we've used as you hear about our community health improvement plan. Prioritizing our work around a few key issues, tackling some projects, ongoing orientation and training, and having actionable takeaways both for our council and the public. So those are some of the things that we've prioritized as a group this year. And we conducted strategic planning as a group, and these are some of our wins that you see listed on the screen here. So a variety of things that we worked on over the past year to be more effective as a multi-purpose collaborative group serving this community. We also had presentations. That's a part of what we do. And the group meets basically monthly. And these are some of our presentations for the past year. We heard about the Career and College Access Network, the Midland Public School millage renewal, we had a food security panel. We talked about federally qualified healthcare collaboration, the Midland Housing Continuum. We heard from our Midland County superintendents. We heard from an affordable dental panel. And we heard about top wins from each of our members this past year. We endorsed some things, as you heard about advocacy, a part of what we do. We had a letter to the editor in support of the Midland Public Schools school millage renewal. We had support for the Michigan 211 state budget funding. We had a letter of support for the federally qualified health center, and we approved the Health and Human Services Council serving as a backbone for our Juvenile Justice Partnership Committee. And as part of what we do, we work to have moments that help us learn how to include all in our community as we think about diversity, equity, and inclusion, and how do we make sure that all voices are heard and that we understand that. So these were some of our learning pieces that we had in 2024 as part of our work as the Health and Human Services Council. And one of the things that the Health and Human Services Council has worked on for the past several years is our Community Health Improvement Plan. And the background on this plan, we have done for many years a county health survey and collected data And from that, as well as many other data sources, we said, what are the key things that when we think about health in our community, we need to focus on? And these are the three areas: healthy living, mental well-being, and substance-free resilience. So to talk about these areas and what we've done, what we have planned, we have some panelists with us today. In the healthy living area, we have Brent McCullough, who's a manager of community health from My Michigan Health. We have Katie Romo, who's a public health preparedness coordinator for Midland County Department of Public Health. From our mental well-being, we have Kathy Snyder, who's the director of the Midland Area Wellbeing Coalition, and Kiara Cameron Wood, who's executive director for 211 of Northeast Michigan, and Sam Price, who's president CEO at 1016 Recovery Network. So we got a great panel today that represents the work of many people in our community. You just get to hear from them today. So we're going to start by having you define each area and describe the factors that prompted the focus on each area. So we'll
that, and also looked at tobacco and alcohol use, and in tobacco particularly e-cigarettes and vaping, and also particularly among the younger population, including down to younger teens, seeing a pretty significant increase in that. And then also we've been looking a little bit closer at some of the maternal and infant health data. So births to mothers who smoke is starting to increase again, as it had gone down previously. And we've decided to look a little bit outside of just our county as well, just because we know that there's some crossover in surrounding areas and where they might receive care or attend classes. So we've looked at some of those counties as well.
All right, and preventive services contribute to healthy living. So this data provides a snapshot of the Midland County Immunization Report Card. And so for essential childhood and adolescent vaccines, we can see that Midland County is relatively doing well compared to other Michigan counties. However, when we look at the World Health Organization target of 90%, we do still have some work to do to reach that 90% across all categories.
All right, and then in mental well-being, some of the data there.
So the end of last year and into the first part of this year, we actually were able to conduct a very specific mental health survey. 89% were satisfied with the care they received. 31% seeking mental health care couldn't get services, which was the part that we were like, oh, let's talk a little bit more about that. And then there were reasons for not getting the needed care. And a lot of them were lack of available appointments, cost, insurance issues, and not knowing where to start, right? Where do I start? Who will take my insurance? How can I get there? And sometimes I want to point out too that some of those appointments were just not during times that people could access them because it was during the day, during regular working hours when they couldn't necessarily take time off work.
We also know that mental well-being is more than the absence of mental health challenges. And twice a year, this company, Zen City, provides residents with an opportunity to share their voice through a quality of life survey. This uses 2020 census data to get a representative sample of our population. The most recent survey, which was closed in December of 24, showed that 79% of people responded positively to this question. On a scale of 0 to 10, how satisfied are you with how your life is going right now? We had about 14% of people said they were neutral to that question, and 7%. So these show us that mental well-being is an important focus area for us.
In the substance-free resilience space, we have a tendency to focus on what are some of the primary substances that are really driving people into care, and we watch those trends each and every year. These numbers represent those people that have accessed the public system, and what they're saying is their number one area of concern. And as you can see, over the last several years, opioids have been kind of trending in a downward position where alcohol has kind of reclaimed its number one status. It had been historically for a long time until we were in this opioid crisis. So that's a good thing in terms of how some of those trends are shifting and changing. Unfortunately, we're seeing a significant rise in stimulant use disorder coming forward, particularly with people who have become addicted to methamphetamine. So that changes our strategies in terms of how we approach community response types of services through the coalition and some of our work there. And then as we continue to also look, as it relates specifically to that opioid issue, because the biggest thing driving that is the sudden overdose fatality issues that we've run into. And so while EMS runs have shown less distribution or use of Narcan on those runs, hopefully that's a part of our success, and that Narcan is in the hands of more citizens, and they know how to use it when they're faced with those unfortunate circumstances. But we also see that we still remain pretty consistent in terms of the number of fatalities that we're seeing in our county, so that we're looking at how we try and address those, again, through some of the actions that we take. The one thing that I'd also highlight is that just over half of the runs that the EMS had to do on these overdose situations were related and identified as self-harm related types of things, which again triggers back to what our colleagues in the mental well-being space are talking about, because if it's driving somebody to that circumstance, then how can we as a community get around those folks more and support them so that they're not in that situation?
Great. Thank you. And it really shows the interconnectedness of all of our work, which I think is critically important as we think about our community health improvement plan and as a health committee, how we approach it. And you also see the rich data that's available in all these different areas. And we'll have more coming out. The Midland County Health Survey was finalized around the end of this past calendar year. And in the first quarter of this year, we'll have the results. And we'll be able to share that out with all of you in the community. And I think that will be helpful too for us as we say, do we need to tweak our strategies any? Are there things that we need to pay attention to that maybe aren't currently right there in some of the strategies that we've got planned? So, but let's take a look back. And let's talk about 2024 and some of the things that were accomplished this past year through the work of our health committee and our community health improvement plan. So we'll start with healthy living.
Sure, thank you. A few of the accomplishments this year start with our food navigator. We were hoping to sustain this role, and we've done more than that through a partnership with My Michigan Health, who's created a full-time education position in Midland County, and that role also doubles as the food navigator. So that role has been able to expand. We broadened the scope of that. The food navigator provided some sampling days, some SNAP education benefits to farmers market attendees, and really did a great job connecting attendees to a lot of the other community programs throughout the area. So that was very beneficial to be able to broaden that scope and expand that role. Additionally, our
Provider by the Michigan Vaccination Partners. And so this was really exciting because it really demonstrated our commitment to providing a welcoming and inclusive clinic space. The really neat thing with this certification is that it provided additional disability awareness training for our staff. It gave us an opportunity to build a sensory-friendly space within our clinic, which we've received really positive feedback from individuals that have used this space. If you haven't seen it, you can see a video tour on our website or stop by and take a look around. It is a really neat space. And really the goal with that is to remove barriers if individuals are seeking.
24 related to mental well-being are a decrease of depression and anxiety for all ages, and really focusing on really what those screenings that are happening in doctors' offices, including, you'll see almost 100,000 screenings, right, for depression, 25,000 for anxiety, and then finding that other people are using these online screening tools, which is great. That's a great increase. So increased awareness of mental health resources, promotion of the mental health resources such as the MoodFit app. If you guys don't have it, I highly recommend it. I was just telling Kathy next to me that I just, right before I got a notification from MoodFit to take some deep breaths, which was well timed. My Hope portal, we are migrating that. This was started as an initiative several years ago. We thought we were having great traffic, and then in one of our coalition meetings, we found out that the 5,000 people who were visiting the My Hope portal were all from Poland. And that there's some group in Poland called My Hope. So we're like, maybe not. So we are migrating that to the 211 site. The 211 site is being updated and reinvigorated, and that should be ready to go in the next month. But we'll be able to find a very separate space for those mental health resources. And we also implemented a mental health navigator using some of the last ARPA funds to kind of give that foundation regionally. And we're really looking to regionalize that because we know that in this area, people shop, work, live, go to school, huge crossover between all of Midland and the surrounding counties, but to really help people find those services that they need. So that mental health navigator is
Positive assets for youth adults and older adults with the focus last year on cultivating positive relationships. One of the things that we realized fairly quickly on is that we have a youth developmental asset model that we use robustly throughout our community. We also have an older adult asset model, the optimal assets for senior living model that we use in our community. And then the space in between does not have a model. And there isn't one in existence. And so what we did last year is partner with the University of Pennsylvania and a team from their Master of Applied Positive Psychology program to build an adult thriving asset model for our community. And that happened throughout last year. We piloted the survey, and we're getting ready this year. We'll talk later about what we're going to do with it. But we also did an information campaign. We continued that. We know that that's important to engage our community partners. And around the theme of accomplishing what matters, which spans the lifespan, we had partners from LEAD to Family and Children's Services to My Michigan Health to the Rock Center for Youth Development, all contributing articles that were shared on Max Loves Midland and throughout social media on those topics.
So in our space, our coalition has really worked diligently to figure out how can we continue to educate and equip those in the community. So we hosted our third annual Youth Development Summit, which is building on the developmental assets for our young people. But as an extension of that, we also got into a new asset space, which is focused on recovery capital for those folks that are working towards recovery from the substance use disorder, and how can we build their developmental assets, if you will, because we know that helps sustain them. We also did some work in reorganizing our coalition as well. We implemented a new committee structure, including the introduction of a harm reduction group that really focuses on the logistics, tactical work of how do we get more Narcan distribution boxes out in the community, which led to 2 being put out there and hundreds of Narcan doses being available and taken by our citizens, doing more training so they know how to use that if they find themselves in the face of those types of things. And another thing through our youth group is focused on prevention work, particularly reigniting the space, if you will, bad pun, looking at vaping interventions that we can bring into the schools, because that is a growing problem. Again, if you go back to our data stuff, that's doubled in the last time that we've studied things. We know that that is a significant gateway in terms of how it cues up a young person's brain for experimenting with other things when they are struggling with other kinds of mental health concerns and turning to that for relief. So how we can clip that early is another focus of our work.
Great. So a lot accomplished in the last year, certainly, and yet we know that these 3 areas still are important areas of focus for our community and for our health committee and our community health improvement plan. So let's talk briefly about what we have planned for 2025.
Sure. So healthy living, we really want to capitalize on the success of 2024 accomplishments. And one of those ways is to continue enhancing our education around physical activity and nutrition. One way we're doing that is offering a lifestyle medicine class. It's going to be open and free to the community. And we'll be able to measure our success through that class through biometrics and lab measurements for pre and post. So we've seen some early on evidence of the success of that program. So hopefully we'll be able to expand that into the community and see even more of that. We also want to make these programs intergenerational and also target the maternal and infant health groups as well to ensure that we're looking at the healthy living metrics for all demographics. Additionally, we want to continue expanding the MSU class offerings. We've always had these traditionally through the farmers market season, but then it becomes a question of what happens in the winter. How are we going to target food insecurity in these PPR programs in January and December? So we're going to be planning for some winter programs with some partnerships with some grocers that can offer the same types of vouchers for fresh produce. Additionally, we're going to look at our healthy living team in sort of I'll call it a restructure. We really want to ensure that we're engaging with the team through various sectors in the community and getting more community members involved, not just the agency involvement too. So I think that that's going to help enhance some of those offerings that we have into the communities and ensure that we're targeting all of the right folks within the community and making sure we're getting the proper feedback too from the people that really need the programming.
And for promotion of immunizations, we just want to make sure that for individuals that are seeking protection from vaccine preventable diseases, that we remove those barriers. So, and if there are questions about vaccines, that we have resources available to answer those questions, and that, again, we have those vaccine clinics available for folks seeking those in the community, and that we're also tracking vaccine rates to better understand what our vulnerability is within Midland County.
Great, thanks. All right, and then mental well-being.
So one of the big goals is to address gaps in care for behavioral health in Midland. And one of the things that you'll hear continually, is the use of survey data, right? We're not just shooting in the wind. We're really using information that's been gathered from the community to create these targets. And you'll see that really throughout all of these. So using survey data to identify and address these gaps, expanding the Mental Health Navigator project to increase the participation and reach, and then conducting those follow-up assessments as previously mentioned to mitigate barriers. And then the addition of an adolescent intensive outpatient program at My Michigan Medical Center in Midland. So those are all really great things that will be happening this year to really help us address that.
And in building assets across the lifespan, we want to continue our information campaigns throughout 2025. And it'll be focused on what are assets and why are they important. And we know that these are the strengths and the opportunities and the supports and the characteristics that promote thriving. And that looks a little different. There's a lot of common threads, of course, across the different age groups, but there's some different needs at different age groups. So we want to continue that information campaign, engaging with our community partners, sharing that information through Max Loves Midland, through social media, through the Midland Daily News, helping people to build this foundational understanding of the importance of assets. Because our big strategy is to roll out in late 2025 an asset across the lifespan evaluation. It happens every 5 years for youth in our community and has for well over a decade. It's happened a couple times with the optimal assets for senior living, and we're looking to do a comprehensive look across the lifespan here in late 2025. And this, of course, will help us then to inform our programming then for really the next 5 years. So that'll be really important.
And because it's an ever-evolving space, we have continued to work on how do we update our programming as it relates to the targeted interventions with youth, particularly as it relates to vaping, but knowing that we also need to fold into that, because it does get into the adult space as well, how does cannabis, particularly in the vaping space, really come into play, and what are some of the harms that are associated with that, and try and establish some more accurate information in terms of social norms and understanding in that particular space. So we continue to evolve programming and messaging as it relates to that. Building on the success of our first Recovery Capital summit that we had, we're going to focus particularly on employment. Our organization is starting an initiative called the Recovery Friendly Workplace, which is kind of building on the momentum that the Regional Alliance has already been doing with mental well-being in the workplace. So now we're going to be able to also look at how we can help employers target the support of their employees who might struggle with some kind of substance use disorder. And then in the overdose space, we continue to look for ways to kind of rehab old newspaper dispensers, you remember newspapers, right? Well, some of those are not used so much anymore. And so we can convert those into Narcan dispensers and put them in front of local businesses and stuff like that. So working with communities, partners to get those out and get more training in the hands of folks to be able to do that. And our opioid fatality review committee continues to meet so we can study these tragedies and see are the things that we can learn to do better next time, where there might be some gaps that we hadn't thought of that maybe in messaging, programming, somehow we could stop those numbers from going up. Thank you.
Yeah, thank you. So some wonderful plans ahead. And I think the next question then is, how can folks get involved that want to help? And then how will you know as the year goes on that you're making progress in these areas? And I know some of you have already referenced some of the numbers you're going to use to do that. But let's talk a little bit about how can folks get involved that want to help, and anything else you'd like to share as you look ahead to 2025.
I would say to simply reach out. You have our contact information here. We're always looking to engage. As I mentioned earlier, we want to see more community engagement in our healthy living team. So reach out and we can find some work. I think we're going to set up work groups through the various sectors of the healthy living team, and hopefully we'll have a little bit more engagement from folks. So, just being willing to help out the team, and that might look like promoting some of our classes, come with ideas, brainstorming, and things of that nature. So, and that is going to be one of our areas of measuring success. Do we have more community engagement? And that includes participation on the healthy living team, attendance to some of our programs. Internally with some of those programs, we'll have our metrics for success around, lab results or health outcomes in some of our areas specifically, but definitely that community engagement. So feel free to reach out. Our contacts information is there, and we're always willing and open to have others join us.
I think there are a lot of really great events that are, part of each of our efforts and each of our organizations. So participation in those events, sharing of those events, and each of our respective organizations have websites and social media. And then, of course, there's Max Loves Midland that shares those events and efforts that are ongoing. So monitoring those and sharing those is a really great step that the community members can take. And even just taking small steps towards our own personal health is something that we can do that just makes us a more healthy and resilient community. And then as far as knowing whether we're successful or not, for our part, we'll be monitoring vaccine rates within the community and then also monitoring communicable disease rates.
Well, I think for the mental well-being area, we are always looking for people that are interested in this, that would like to join our work groups. You're welcome to do that. We also have the plug at the bottom there to take and promote these surveys for youth, adults, and older adults. That'll be really important for us to gather data that can inform where we're doing well already and where might be some gaps and opportunities that we can boost mental well-being throughout our community. So continue to learn, continue to connect. Utilize Max Loves Midland. There's lots of places on there for people to share their voice, for people to get connected in the community. The calendar where you can find out about these vaccination clinics and things like that. So get involved. I think that would be engage in our community. That would be my message.
Yeah, probably again, like when you receive the information about the surveys, take it, and then get people in your life that you know to also take it. The more information we have, the better. The first thing I'll always say is, call 211. Get other people to call 211 to access these services. Hundreds of services in the area and throughout, Northeast Michigan. So I think that is one way. Also, just a reminder that everyone up here and several other people that I see in this room who I know are deeply involved, we can come talk to people, right? We can come to you and do presentations about these aspects and other aspects, whether it's a church group, a work group, lots of willingness to participate and be part of that and to promote that engagement throughout the community. Specifically, since 211 is the one that's hosting the Mental Health Navigator, as far as success, what we'll be looking for is increased intakes for that specific thing, and making sure that people are getting those better connections, so.
Mm-hmm. So in our space, from an outcomes perspective, what we really monitor is how are developmental assets among our youth increasing, and then on the adult side, how are people's recovery capital scores increasing, and are we doing the right kinds of things that we are seeing translation to people feeling equipped and empowered to be able to have the resilience that they need to face the challenges that come in all of our lives. In terms of what you can do, first is be willing to hold space for the people around you, for the struggles that they have. It can be incredibly embarrassing for me to share with somebody, to be vulnerable enough with somebody that I'm struggling, whether it's with an addiction, with a depression, anxiety. It takes courage to say that. So you have to help show somebody that it's safe to say that and to talk about that and not judge them, so that they can continue to do that. And even as they struggle, still hold space for them is something that we're all able to do right now. And then if you think of it from a workplace standpoint with your work family, if you are an employer, if you are an employee, and you want your workplace to be more able to hold space as well for those struggles, then the Recovery Friendly Workplace Initiative, the mental well-being workplace initiatives are valuable things that our work families can also embrace and take action on as well.
Just to reinforce something that Sam just said is that, I meant to mention it and I forgot, is that there are a lot of trainings, free trainings, low-cost trainings that are available in the community. Mental health first aid, ASSIST, which is suicide support, that are available, that you can take, that can help you with that holding space and help you get better at helping people in your life. And that is something that you can do. That's not a big investment on your part, except for time, and that can have a big impact on people around you.
And really, I'm thinking as we're talking about this, just the way we can be supportive of one another. And I do love, I think back to our community vision statement, that, we want to build, an exceptional place where all can thrive, and we're working to allow people to be who they are, and us to be able to support them through their journey. So I love that. And so you saw some contact info on the folks up here. And also, make sure you like our Facebook page, Midland County Health and Human Services Council. Like it. And also the website, Health and Human Services United Way of Midland County hosts that website. So please check those out for additional information that you can find on the work that we are doing. And again, as part of the Midland County Health and Human Services Council, as the Health Committee working on our Community Health Improvement Plan, it's exciting to share this with you. And I'd like to close, they often close a podcast with a lightning round, right? So our lightning round is just, what are you most hopeful about in the year ahead?
I'm hopeful that we'll continue to see increased community engagement in the work that's happening in our community to make it a better place for everyone.
I would second that. As we learn more about civil health and civil engagement, and the more volunteering, the higher voting rates, things of that nature all correlate with a healthier community. And that means that people have to be out and active and engaging in the community. So I would second that.
I would say that people just feel like there's at least one other person in this world that values me, that I'm connected to, that I know that I can always turn to. And as long as there's that kind of connection, then I'm going to be okay.
For me, as soon as Sharon said that, the first thing I did looking outside was heat, warmth. Hope that that's at some point we will not be in negative freezing temperatures. But one of the things is, I really liked what Sam said about someone having someone to connect to, but also just something that I've really noticed, and especially in Midland, is the resources are there, right? And my hope is that people will realize that they do not have to struggle alone, that people will realize that there are people who care, and that they will find a space to reach out and say, I need help. 211. I'll just one more time.
So I think just every day is an opportunity to make a positive impact. And I think just imagine the possibilities if we all walk out of here with that goal of making a positive impact each day. I mean, it would just be amazing.
Great. Well, thank you all. And what we'll do, we're not going to actually take questions here today, but we invite you, however, you could certainly post through the Facebook page. Also, you saw email addresses from those that presented today, so you'd be welcome to reach out there. Those of you that are in the room today, we're happy to visit with you afterwards. And I want to do just a quick couple thank yous. Thank you, of course, to United Way of Midland County for their support of the Midland County Health and Human Services Council. Thank you to Health and Human Services Council members for the work that you do every day, each month as we gather. Thank you to our presenters today. And I need to give a shout out out to the city, because we're using their space today. Thank you very much. Our tax dollars at work. And also to MCTV for providing staff support in their live streaming on their YouTube channel and channel 189 right now. There will be replays on channel, and they asked me to mention this, on channel 191 on demand via their website, and then basically all your favorite streaming platforms. You can find this if you would like to listen to this again or share it with others in the community. So again, thank you to all of you who came today, and thanks for all that you do to support our community.